Hello everyone, my name is Colette O, and I will be presenting on toxoplasmosis. Toxoplasmosis is caused by the protozoan parasite Toxoplasma gondii. You can see its classification on the screen. This is a eukaryotic parasite, and it is an obligate intracellular parasite, which means that it can only replicate inside of its host, and especially the sexual replication of this organism only occurs in its dominant host, which are felines. This is an extremely prevalent parasite. It's estimated that 1/4 to 1/3 of the world's population is infected with Toxoplasma gondii. The life cycle of Toxoplasma gondii occurs in 3 stages. The first stage is right after sexual replication, so it only is formed in felines. And this is the oocyst, and it is found in both unsporulated and sporulated forms. So initially the newly formed zygote will form an oocyst, which will exit the cat through the cat's feces, and then once it's in the environment it will sporulate into oocysts and become infectious. And the sporulated oocyst can exist in the environment for up to 4 months, so quite a long time. The second stage is the tissue cyst or bradyzoite. Basically, bradyzoites are within a tissue cyst. And this is the dormant and slow replicating stage of the parasite's life cycle. And thirdly, there's the tachyzoites, which is the distinctive bow-shaped form of the organism, and it is the very infective and fast replicating stage of the organism. So this is the life cycle in more detail. As I said, it first forms oocysts in cats, exits through the cat's feces, sporulates in the environment and becomes infective. At that point, it will infect the intermediate host, which is basically any mammal. So humans, mice, pigs, sheep, a lot of mammals are infected with Toxoplasma gondii. And this is by the fecal-oral route, where the oocysts enter the humans or the mammal's intestines after ingestion. And then in the intestines, it will differentiate and form the tachyzoites. And these then infect phagocytes, enter into phagocytes, enter the lymph, spread to lymph nodes, and then throughout the blood, from which it can infect almost any cell type in the body. After this stage, it will form tissue cysts in the tissues with bradyzoites inside the cyst, and these lie dormant in the tissue. However, they can be spread through the eating of infected meat, where the tissue cysts are in the meat, and either humans or cats can then eat it, and the process again starts with tachyzoites forming in the intestines. It is also possible for a mother to pass the infection on to a fetus through the placenta, and these are the tachyzoites will pass through the placenta. So infection happens one of 3 ways, and a possible 4th, very rare method. First, by eating raw or undercooked meat, so the tissue cyst exists in the tissue and is not killed before ingestion. Fecal contamination, and these are the oocysts in feline feces. And then congenital infection, when a mother is infected during pregnancy and passes on the infection to her unborn child. And lastly, there's blood or organ transmission. This is pretty rare because it only occurs if someone who is donating blood or an organ is pre-infected and then passes on those tachyzoids or bradyzoids to the person who receives their blood or their organs. But usually these are screened before transmission, and so are not passed on. The course of human pathogenesis, there are two forms. So the normal pathogenesis occurs with a person who has a fully functioning immune system. The tissue cysts or the oocysts enter into the intestines. They differentiate into tachyzoids and travel throughout the body, and usually they spread to the lymph nodes first, where the only symptom that you will generally see distinctive symptom that you will see is lymph node enlargement. This can be accompanied by illness, fever, malaise, sore throat, headaches, and things like that. But it will normally go away by itself without treatment. However, if the person is immunocompromised, this infection does not stop, and it can cause necrosis of lymph nodes and other organs that become infected through the blood. And the tachyzoids will infect these cells and kill them due to their rapid multiplication. It can also cause encephalitis in the brain if it spreads to the brain tissue. And then depending on which organs are most affected, you can have vision problems in the eye, spleen, and liver damage when it infects those areas. And if not treated, it will become fatal due to the large amount of cell necrosis. The congenital infection will cause much more severe symptoms, and the normal ones include hydrocephalus here, which is an abnormally large head. There can also be microcephalus, which is an abnormally small head, but hydrocephalus is more common. There's also cerebral calcifications when it enters the brain and kills brain tissue. And then retinochoroiditis, which is when it enters the eye and causes lesions of the eye, which usually lead to blindness or at least vision problems. And normally this is very dangerous for the child, and unless the symptoms are mild, the child will probably die. Sometimes abortion will happen before birth, and sometimes it will be born and then die afterwards. Diagnosis is done by conducting serological tests, testing for the antibodies. And this is normally the only method of determining for sure infection with Toxoplasma gondii. You can also conduct biopsies to look for the actual presence of the tissue cysts or the tachyzoids. But those are less normal than just conducting a serological test. Normally, there's no need of treatment if it's just a normal infection. The body will take care of it on itself. However, if it's an acute infection, then sulfonamides or pyrimethamine with folinic acid are usually prescribed, and these are very effective at killing the tachyzoids. However, they do not affect the tissue cysts with the bradyzoids, which means that the person is usually infected for the rest of their life, and this occurs in both normal and acute infections. The body will kill the tachyzoids, but it will enter into tissues and form tissue cysts where it will lie dormant for the rest of the person's life. Prevention is usually thorough cooking of meat, avoidance of fecal contamination, not feeding cats raw meat, and pregnant women should not clean out cat litter boxes or come in contact with feline feces. And animal infections also occur, and they're very similar usually to human infections, with normal pathogenesis and then acute if the animal is immunocompromised, and it can also cause abortions, especially in sheep. These are my references, and that is all. Thank you very much.